There we go. Now are we? This is what you'll be saying. If you want to.
I don't want to.
Trying to get the audio. Yeah.
Talking yet. You want them to see you?
No.
Hey, Craig. Ralph is trying to join by phone. He couldn't make his Zoom work, so you're still muted, Craig.
I had suggested that the other day because I know he told me to have issues.
Yeah, and thanks for sending that, Kyle. I really appreciate it.
This is a lunch meeting, isn't it? Not lunch. I'm in between Zooms.
You can eat.
Hoyton, there was a phone call, a phone in, I believe, on the instructions, wasn't there?
Yeah, and then Kyle added that recently. So and I sent that to Ralph so he can call in. I don't see him yet. Oh, there's one call. That doesn't look like him. Who is that joining us on the phone call?
Ralph.
Thank you. Glad you could make it, Ralph.
Hi, Hoytson.
Hi.
Hello, Ralph. How are you?
Hi, everybody. Hi, Craig. No golf today.
Little chilly, huh?
Yeah, slightly. I'm a Janice Huff fan from NBC.
Looks like Kyle Anderson.
Louise Johnson appears to be in the waiting room twice. She really wants to get in. All right, well, welcome everybody. Welcome, Louise. We'll get started in just a moment here. Karen, you should be a co-host currently. So
Okay.
if people pop in, you should get a little notification that says so-and-so is in the waiting room. Between the two of us, if we can just keep admitting folks, that would be good.
Okay.
All right, well, welcome everyone. We're glad that you have joined us. I'm not gonna say a whole lot, except that we felt like this was an important conversation to have, and you know, in any way that we as the church could help support you all and support our community and provide resources. We felt like that was a good thing to do. And so here we are. So I wanted to mention that this is being recorded, this call. We're going to share this on our YouTube channel. For those who can't be a part of this current conversation, we'll also make this call and some of the resources that we share available on our website early next week, so that if you're aware of somebody who may need information, help, resources, you can send them to our website. Again, they'll be able to see the information that will be provided here in this call, and any of the questions that are asked, as well as any of the resources that will be shared. We're working on putting together a shared file online so that you have access to all of the resources that we share as well. So without any further ado, Karen, am I turning it over to you or am I turning it directly over to Carol?
Well, actually, I'm happy to introduce Carol. We are lucky enough today to have the health officer of Lawrence Township, Carol Chamberlain, who is an expert
Hey.
in all things COVID and has made time in her crazy schedule to be with us, which we really appreciate.
Wow.
So Carol will be outlining some important information. There'll be time for questions. And as Kyle mentioned, there are a host of resources that Carol has provided that we will make available for folks to follow up. Good frequently asked questions about COVID and the vaccine. So Carol, why don't you go ahead and take it from here?
Okay, thank you. Thank you for having me on the call, everyone. As Karen said, I'm Carol Chamberlain. I'm the health officer for Lawrence Township. And I am happy to share what information I do know about vaccinations. As many of you probably know, back in late December, both the Pfizer and the Moderna vaccine were approved for usage. And so at the end of December, the hospitals got their share of vaccine to start doing healthcare workers.
Good.
Late in December, the last week in December, when Moderna became available, there is now Moderna available for use in other locations. So the rollout to begin with was first all 1As, which 1As are community health workers. So people who work in dentist office, eye doctors, health departments, clinics, any place that's a non-hospital based healthcare worker, 1A vaccinations have started. And what we've done here in Mercer County is there are 8 local health departments that cover the 12 municipalities, and we have joined together to coordinate our vaccine clinics because of the limited amount of vaccine that's currently available. This number can fluctuate at the current time, and I was just on a call yesterday with somebody from the governor's office, but at the current time, Mercer County is guaranteed as a whole for Mercer County, not including the hospitals, but Mercer County and the local health departments, 800 doses of vaccine a week, which is not very much, as you can all understand. So what we've done is equitably take the percentage of the population in each municipality, and that many appointment slots are designated. So for example, Trenton and Hamilton, which have a much larger population than Lawrence or Hopewell, they get X number of appointment slots based on the percentage of vaccine we get, and we divide it out based on, you know, our population. So unfortunately, that means we have limited vaccine. And so with those numbers using the 800, or I'm sorry, we're using 500 doses right now at our clinics. And so Lawrence Township gets 44 appointment slots. So we have started by doing 1As, which are the community healthcare workers. We've gone through a lot of them, in addition to the resources that we have through those clinics that we're running. And we're running where we're joining staffs, we're rotating throughout the county as far as the locations of the clinics, but they're all by appointment. There's no walk-in at this point in time. But we're also trying to find other locations where people can get their vaccinations. For example, Princeton Hospital was willing to help us with our 1As, which included the community healthcare workers, and then they opened it up also to police, fire, and EMS. So they were willing to take some of our 1As, and they assisted us with that. Some of you may know that last week Princeton opened up some slots to the community, so we've also been directing people to go and sign up there. As many of you probably already know, because if you're interested in getting the vaccine, you've probably seen that the state has a sign up. And the idea conceptually behind that sign up is you sign up, and once your eligible category comes up, you'll get an email to say you're now eligible. And then my understanding of it is then when there are clinics in your area, they will notify you if you'd like to schedule an appointment. So that's another system. Just this week, they got a live hotline, because as we all know, there are elderly people who can't sign up online, or they don't have somebody to help them sign up online. So I think Karen has included on the one handout, the vaccine call center that the state has set up for people to call in. So if you don't have the ability to sign up online, you can call in and there should be assistance there to help with that. The other locations where vaccines are also being offered are a few of the area hospitals. As I said, Princeton Penn Med is doing, and when they get vaccine available, then they will open up their registration. Robert Wood Johnson is now doing it. And I believe, Karen, that you've included that email also as far as where people can sign up and register there. And Capitol Health is doing community vaccinations now also for people over 65 and under 65 with comorbidities, but that is through the state's sign up. So if somebody's interested and they're located near there, I don't know what the wait time is right now, but that's now available. So let me just back up 1 second. So we've been working with getting the 1As done. So then about 10 days ago, I would say, about the governor has opened up to some 1Bs, but not all 1Bs. So that would be people over the age of 65 and people with the comorbidities who are between 18 and 64. We say 18 and 64, even if it says 16 and 64, because we only have access to the Moderna, and the Moderna cannot be used for anybody under the age of 18. So we are currently, we have a waiting list at this point in time for the vaccine for anybody. 1A has a wait list, and then what we call the 1Bs, even though it's not the full 1Bs that was originally supposed to be the 1Bs, but people over the age of 65 and people with comorbidities. We have been focusing, when we have gotten slots recently, we're trying to do our elderly first. So our first clinic in West Windsor doing seniors, we did the majority, 68 out of our 77 slots were individuals over the age of 85. As we've seen, unfortunately, that the people who have the most significant, I guess, challenges when they get COVID and the most deaths we've seen are in elderly people, which is why we wanted to focus our vaccinations on getting those people protected first. I can tell you that right now, we have a list of probably over 650 people on our wait list, and our wait list means that when we get vaccine through these county clinics, we make appointments for the people who fit that 1B category, unless we still have 1As to do, because 1As are still obviously a priority. I don't know if I'm telling you too much or not enough, but I'm just trying to give you a general overview of where we are at this point in time. So as of now, as more vaccine comes in, we'll continue to use our Lawrence designated appointment slots to get people vaccinated as fast as we can. And we continue to encourage everybody who calls to call the other places that may have vaccine that comes in. There are a few urgent cares that are ready to vaccinate, but the vaccine supply just is not there yet. I don't know how else to explain it.
Right.
Some of the hospitals still have some from when they initially got it, and they're using that up. But some of the urgent cares just can't get it yet at this point in time. So I know we're asking people to be as patient as they possibly can be. I know everybody's anxious to get it, but as we get the vaccine in, I promise you, we're trying to get it out as fast as we can. I'm going to stop there and see if there are any specific questions, or if Karen, if there's something else that you would like me to go over at this point in time.
We should sign up there too.
Okay, I think this is all great information. I think what might be helpful is, because some folks have already tried registering, and I think they're wondering when they're going to hear. And on that summary that I've provided, that will be available in general on Monday, but there's the phone number there. There's the website where you can go in and register, with the state. That's not the same, obviously, as an appointment. But if Carol, if folks registered with the state, should they still shop around to these different locations and try to sign up? What's the best way for people to make sure they're getting as early in the queue as they can?
I would recommend doing that too. I just ask that if you do sign up in multiple locations, that if you do get an appointment and a vaccination someplace else, that you just contact us so we can remove you off our list. And I'm assuming that other locations would ask the same thing. But I would say there are different pots. So if you go through the NJVSS site at this point in time, our clinics right now aren't on that. The state might make that a mandate eventually, but we're trying in Mercer County to keep our vaccine here for our county residents, right? So if you go into the big NJVSS system, it opens it up to people throughout the state. So we're trying to hold on to the vaccine doses and keep them in the county the best we can as we receive them in. We're not trying to be stingy. We're just trying to, because there's mega sites, there's 6 mega sites, and I think that information was shared also. And anybody can sign up for any of those mega sites, but they get their allotment of vaccine also. So I think if any place you can sign up, we have no guarantee of when we'll get enough vaccine to address everybody on the waiting list. So I would recommend signing up where you can. But we do recommend that if you do get a shot, just let us know so we can take you off our list.
Okay. In terms of, I know one of the questions that had come through was about how, if you get your first shot, you can get scheduled for your second. And I know there was some blips along the way, I guess, with folks who got their first shots and were not contacted about follow-up. But am I correct, Carol, that now when you get your first shot, right then you should be making an appointment for your second with the same location?
If the system works the way it's supposed to, when you get your first allotment, like we get an allotment of 500 doses and we were doing it today, just for example, then the CDC would automatically ship us vaccine to have ready for 4 weeks from today for the second doses, right? So when we're running our clinics, people should be assuming that, well, and there's usually a sign at the clinic and it says, that you should expect to come back 4 weeks from today to get your shot. Now, I know there was a glitch in the state system and it's called the NJVSS. So it's the New Jersey vaccine system. And they had a glitch where second doses weren't coming through or you weren't able to schedule your second dose. So I can't speak for those sites, but ideally, when you leave from getting your first dose, you should have a general idea of when your second dose is going to be. And then what we're doing here in Mercer County is you will be notified with an email when your second dose is definitely scheduled.
Okay. I'm seeing in the chat that there was a question. Someone had signed up at the state site and got an email that they were 1C and they signed up twice for slots and got confirmations, but they were both canceled almost immediately. And that would be because right now 1C is not a group for which shots are open. So if you go through and register with the state, they will tell you what you are, 1A, B, C, whatever you are, and that will tell you when you're going to fall in the queue. But the advice to try, registering through the state, which will apply to Capitol Health and several other locations, as well as you're saying, Carol, talk to your local health department, talk to the other specific sites like the hospitals and see basically how many lists you can get on to be notified when there are spots.
Well, exactly. Capitol Health is doing it through the state sign-up site.
Right.
But my understanding, and this could change at any time, but my understanding is that Robert Wood Johnson Hamilton has their own sign-up site, which I believe I gave you that information. And Princeton Penn Med, when they have vaccine and they can schedule appointments, they have their own scheduling system at this point in time. Please, everybody understand this is very fluid. We could get to Monday and the state could say everybody has to use the online system where you're not getting vaccine. And But this is how it's working at this point in time. We are being told that it will eventually be mandated that we use that system. But at this point in time, as I said, we're trying to get our vaccine fairly distributed through the county to each municipality so that every municipality has some coverage there. And so that's why we're currently not using that system. But there may be a time when we have to, but I would say the recommendation would be to sign up wherever there's availability to sign up. But as I said, you also don't want to hold those positions or those places if you've already gotten your shot, and you should ask to be canceled off at any other sites.
Right. I also saw on the list that there were 2 ShopRites in Pennington that, we're going to have available slots. Go there to register. But when you do, they're like, we have no vaccine. Right now we aren't taking any appointments. So, it's, as Carol said, going to be fluid. And, folks are asking here in the chat, and a lot of people have this question: how do I know when my category is going to be available? Say I'm a 1C. There's no specific time now because, as Carol said, the vaccine supply is the issue. But
well, the vaccine supply is the issue, but also the request in the category above, right? So
Right.
We thought we had all our 1As done, but then you keep having people who come forward and now they've decided they want one, or in the 1Bs. And we're not even in a full 1B right now. We're in a partial 1B. It's not everybody in the 1B. And
right.
all I can say is it was explained to us to begin with that we would get through 1As, then we would go to 1Bs, we would get through 1Bs, and then we would go to 1Cs. It hasn't quite worked out that way because we hadn't finished our 1As, and the 1Bs, some 1Bs were then eligible, so it kind of mixes it up a little bit. So when you'll be eligible, it's hard to say. It depends on the amount of people in the category above who want it and need to still get it, and it's going to depend on the supply of vaccine that's available.
Okay, I'm looking at additional questions here. Someone asked, how do we find the classifications that define 1A, 1B, and 1C? If you go through the state registration process, they will ask you questions about your employment and your medical situation, and out of the bottom of that list of questions comes the classification. But is there a summary somewhere, Carol, of just in general what the criteria are right now for those classifications?
There is a wealth of information on the state's website. If you just Google NJDOH for New Jersey Department of Health COVID vaccine, and they have, in addition to the few items that I shared with you, there is as much information as you want about everything from the development of the vaccine to the categories, who is eligible, to information on the vaccine sites that are available throughout the state. There is a wealth of information, and included in there are the categories of 1A, Bs, and Cs, and then to go on to 2s. So yeah, that information is all available on the state website.
And someone asked if you need to register in Lawrence or register with a health department, how do people do that?
Right now, I can just tell you we have 650 people on the list, right? And we have 44 doses a week that we're allotted. We're going to take a while to get through that list. You are more than welcome. At this point, we are taking phone calls and just taking names and phone numbers. We're hoping to have an online sign up, but we're afraid with the people currently eligible that the online sign up and explaining it to people will take us just as long as getting their information. So right now we're taking names, but we're hoping that you could just sign up and be online. There's no way to know where you are in line. That list changes on a regular basis. We ask that if we have vaccine available and there's an appointment slot for you, we will call you.
Wow.
But at this point in time, we can't tell you if you're number 120 on the list. I can't tell you that we're definitely going to call you in 3 weeks. I don't know. We don't know enough about the security of the supply that's coming in to know whether we're going to get 500 doses a week for the whole county or we're going to get 800 or 900 doses. All I can tell you is that as we are getting in, we're scheduling clinics. And it's not just we, the Lawrence Health Department, we're scheduling them countywide.
Oh.
right. And for those of you, for example, my father lives in Bucks County. If you happen to be there, you have to register with the county, so each, place has a way to do it. But here in New Jersey, we have local health departments with each municipality. So they're coordinating with each other and the county to try to maximize, the benefit of the doses they're given.
In addition, Karen, 1 second. In addition, there are 2 potential county sites that are being run, but not on a regular basis right now. But the Cure Arena, which is Capital Health, is working with the county to give vaccinations at the Cure Arena, and those are scheduled through the NJVSS at this point in time. And then there's a site that's open at Mercer County Community College, but that is through the doses that the county gets, not through the state or a hospital. So we're also trying to do county-based ones also.
Okay. There's a question here. Someone said they'd signed their 81-year-old mom up with the state and was a 1B and hadn't gotten an email yet to schedule an appointment. Should they be concerned? And my understanding is no, because as Carol said, they're still trying to get the last of the 1As, and only part of the 1Bs is available now in terms of being able to get an appointment. Is that correct, Carol?
Yeah, I mean, my 87-year-old parents are signed up on the same state website and they've gotten no notification. So I'm not concerned at all. I just think there's a huge demand at this point in time, and we can't, and nobody else can fulfill all the demand at this point in time.
Mm-hmm. And so if you're registered through the state, you really are on someone's list, right? Someone will eventually get back to you about scheduling. Is that correct, Carol?
I'm not in charge of it, so I can't, all I can say is that's what we're being told. I don't know how else to answer that as honestly as I can. That's my understanding. And I believe that when you do register, you get a confirmation of some sort that says you've registered online. And maybe
Right.
somebody in the audience can confirm if they've received any type of confirmation, if they've signed up on the state site or not.
Yes.
Yeah,
did.
I did. Yeah. Yeah. Now, there was a question, would the Lawrence Health Office receive names from the state registry? Probably not, because
No.
you're keeping your own list.
No, not at this point in time. We may eventually, but at this point, to be honest with you, we have enough on our own list that's been generated that,
On their list, that was my.
that's why it might seem like a little bit of a duplication to go on both lists, but I know people are anxious to get it. So if they feel more comfortable being on both lists, as I said, and I know I sound like I'm repeating myself, just if you do get an appointment someplace else, just let us know so we can remove you from the list. That's all.
Okay, so the advice sounds like get on the state list. If you can't do it online, then that hotline phone number is available for assistance. And then also pursue your options with your local health department to get on their list, and perhaps some of the hospital lists that are maintained separately, like Rockwood and Hamilton and Princeton Health.
What about doctors' offices like Princeton Medical Group?
My understanding is that it has not been distributed to them, sadly, and it seems like it would be an appropriate thing to do, but my understanding is it has not happened. As Karen mentioned, a few of the ShopRite pharmacies have it, and a few urgent cares had gotten small.
Penlar is on it through Clover Health. Penlar said they would notify me if anything came in. This is Ralph Lutz, by the way.
Okay, so they will have some at some point, you're saying, Ralph?
Yes.
Okay, well, that's good to know.
Yes.
So right now, it's not being distributed to medical groups. I know the one at the hospital at Princeton Medical Center is their big medical group associated with the hospital is expecting to get it, but I guess they got it and like ran out immediately. So if you're a patient there, definitely, try to get on their list. And they're indicating that if you're with a hospital-based medical group, you will you will get an email. They're going through their electronic medical record system, and they will spit out all the patients who meet certain criteria. When they
Right.
have vaccine available, you might hear from them as well.
Okay.
But a truly private medical group like Princeton Medical Group, it sounds like, are not in line at this point to get vaccine.
That's what I took from Dr. Gatorman the other day when he lined me up to get my shingles shot, which I did
Mhm.
get. So, but that's as far as my shots that I've been able to get.
Yeah.
And just so you know, sir, after getting the shingle shot, you can't have any other vaccination for 14 days
Okay.
of the COVID. So if you do happen to get lucky and get a shot in the next 2 weeks after your shingle shot, you do need to defer until, because that's going to be a screening question when you get to the clinic if you've had any other vaccination.
Thank you. I see.
Yeah.
That's helpful to know. Are there any other key screening questions that folks should be aware of, Carol?
You know, if you've tested positive and you're supposed to be in isolation, if you're supposed to be home in quarantine because you're a contact of somebody, if you've traveled outside of the state within the last 14 days where so essentially if you're supposed to be quarantined or isolated, they don't want you at the clinics for obvious reasons. And going back to the question about physicians having it, there are a couple of things. They have to be signed up for this vaccination registry system with the state of New Jersey. So that's one hurdle to get over. It's not that big of a hurdle, but if you're not signed up with it, you can't receive vaccine. But then also because of the storage requirements, obviously to get Pfizer, you have to have this ultra cold freezer, which most doctors' offices would not have that.
Right.
And then in the requirements for the Moderna, because it does have to be frozen, but you have to have what's called a data logger to monitor the temperatures on a regular basis. If you don't have that equipment and you try to sign up to receive vaccine, you're not going to be able to get it, because they want to make sure that the cold chain management of the vaccine is maintained so that the vaccine is stored properly and used with the appropriate temperature ranges that it's supposed to be.
Right. In terms of, I know I regularly get things from Walgreens that they're going to be having that available at some point. So I think there will be some additional chain drug stores that might have availability at a certain point. Not yet, obviously, but that's something to keep in mind. The other really good news, just from this morning, I read that the J&J vaccine through Janssen is probably getting close to emergency authorization. So
Yes.
it's fair to say, Carol, more vaccines will be coming online and hopefully improving the availability of supply.
Yeah, one of the reasons probably some of the commercial pharmacies who, as many of you probably know, do regular seasonal flu vaccines on a regular basis these days.
Mm-hmm.
The CVSs and the Walgreens have signed an agreement with the federal government, and they are out vaccinating people in long-term care facilities, assisted living facilities, and those type of places. So for example, we have 3 long-term care facilities here in town, and one of those 2 pharmacies has visited each one of them, I think each one at least once, if not twice. And by the end of February, they will have made 3 visits to Clover Meadows, Morris Hall, and St. Lawrence Rehab Center. And they're doing both staff and residents of the long-term care, but not patients who might be there for short-term rehab, but residents of the long-term care facilities are being vaccinated, and staff. And that's, I guess, where the commercial pharmacies are kind of busy right now, because they're going out on the road with their pharmacists and doing those vaccinations on site.
Learn anything that we should do?
Correct.
We didn't know.
I'm not seeing let me see here, other questions.
You want to sign cards? You got-
Let me just add one thing, just something to keep in mind. I believe Karen included a frequently asked questions about vaccine. Please feel free to read that. It'll probably be very helpful and provide a lot of information. But something I just feel that I should share is, and we're seeing this now that people are getting second doses. The first dose didn't seem to have a lot of effects on people. But the second dose, at least with Moderna, because that's the one that we're seeing experience with, that people are having some side effects, very tired, headaches, those kind of things. So we want to make sure everybody understands that when they get that second dose, There may be a day or two afterwards where you're not feeling really great. So we're hoping to get an educational piece ready for when those second doses are being given, so people can look for those side effects, but not be overly concerned, because some of those side effects will be expected. But it's just something to keep in mind. It just popped into my head and I just thought I should share that now.
That's a good point. And I think the other thing that's important to note is,
Working.
let's say you get the Moderna vaccine. From the date of your first shot, and 4 weeks later you get the second one, and then I guess it's about 3 weeks after that that you would be considered, your immunity would have been building. So it's at least a 7-week process. Folks are not going to be immune right away. And as Carol shared with me the other day, it's important to remember that even once you've been vaccinated, the same rules generally apply. You need to wear masks, social distance, the travel restrictions are in place, because again, these vaccines have amazing effectiveness, but it's not 100%. And so Carol reminded me, and I want to share that, folks still need to maintain all of those kinds of precautions, and we'll need to do so for quite a while till more of the population is vaccinated. Is that correct, Carol?
Yeah, at this point in time, and I guess until more people become vaccinated and they see what the efficacy is among the general population, they are recommending all public health measures still be maintained. Whether it's you've been exposed to somebody and you need to be in quarantine, they're still recommending that vaccinated people quarantine, and obviously to social distance and wear masks, because as you said, nobody knows at this point in time if you're 100% protected or you're at 95%, which a lot of, I guess most people who've been in the trials have had about a 95% efficacy. So, but just something to keep in mind. We don't want everybody to go out in the world unmasked and social gathering, having big parties at this point in time. So,
in terms of the variants, Carol, and I know this information changes daily as they learn more, but is there a sense that we know some of the variants are much more contagious even than the initial COVID, but what is the sense at this point about the effectiveness of the vaccines against some of these variants that are appearing?
my understanding is they feel that it will protect people, but I think they're too new to really know. I don't think that there have been trials done on the new variants enough to really have good data on that at this point in time. So I would assume that they'll continue to gather information on that, but I don't know that there's enough out there to really make provide you a solid answer on that.
Okay, thank you. Again, it's just another reason to maintain all those good public health measures that Carol mentioned, because we don't know if everybody's covered, for everything with the vaccines that are currently being provided. So that's a, stay tuned subject, I guess, as you say, as more people get vaccinated and they study this further. I'm looking through here to see if we have additional questions. Okay, some good information in the comments here. And again, what we're going to do is make sure that all the resource materials that Carol provided, as well as the summary, with the phone number and everything else, will be on our website as of Monday. A recording of this event will be put up on YouTube, I guess Kyle said, on Monday. So in addition to the resources you can see.
What is the website?
What is,
The church's website, excuse me.
how do we know what that is?
Which website?
Sure, the pclawrenceville.org. P in Presbyterian, C is in church, lawrenceville.org. That is the church's website, and this information will be made available there as of Monday, and there will be a link to the YouTube video of this discussion today that will be available as well. And we'll put out that information in the Community Well e-news also. So we'll try to spread the word.
Good.
So, these materials will be available. But I did look at the state's frequently asked questions that Carol provided. that's in the folder, linked here in the chat. And it's excellent. It was updated on the 26th of this month, and they've highlighted in yellow the changes. So it makes it, you don't have to wade through the whole 9 pages. It makes it easy to see what some of the new information is. So that's a great resource as well. And as we said, the New Jersey COVID-19.nj.gov has a ton of information. The New Jersey Department of Health, you can Google that and go in their website directly, has a lot of information. And the phone number for appointments and assistance with that is, I'll just read it now in addition to having it on the summary, but that phone hotline is 855-568-0545. And they're available Monday through Friday, 8 a.m. to 8 p.m. There can be a wait. Obviously, the demand is high, but real live people answer that phone, and they got that all up and running on Monday, and people are available to help. Again, covid19.nj.gov has tons of relevant information about, the vaccine itself, about the classifications, about signing up, all of that. So I think what we can do is, if anyone has additional questions after this session, why don't you send those to me? And my email is kbuda, B as in boy, U, D as in David, A, at pclawrenceville.org. And I can collect those and we can get answers from Carol, or provide, answers to you, and or post additional resources on the church's website to address those questions. So please feel free to follow up with additional questions to me directly, and we'll get you to the right place to get answers. And thanks for putting all of that into the chat. Are there any additional questions right now that we can address? I want to really thank Carol, who is swamped and working night and day, for being available and helping pull all this information together for us. She's a wonderful resource, and we appreciate your time and expertise. And we're going to continue communicating with folks about the vaccines and whatever else we learn. And thank you so much to Kyle for making the information available, and he'll be making the video of our discussion today and the resources available on the Presbyterian Church of Lawrenceville website on Monday. And we'll keep tapping into Carol and her expertise, which we really appreciate, at the Lawrence Township Health Department.
Yeah.
All righty. Well, thank you so much to everyone for participating today. And
Thank you.
tuned. More information is coming.
Thanks for having me.
Thank you all.
Thank you.
Thank you, Carol.
Bye.
Wonderful.
All righty. Thank you so much, folks. Bye-bye.